Good day everyone. So today we're going to discuss about the orthopedic impairment and other health impairment. Learning knows no bounds. So it emphasizes that learning is a lifelong journey, unrestricted by physical limitations or challenges. A pleasant morning everyone. In today's topic, we are going to discuss about an orthopedic impairment or NOI. So it is a severe physical impairment of the skeletal or muscular or the neuromuscular system that is adversely affects a child educational performance. It is including like cerebral palsy, spina bifida, amputations and fractures. So in other terms or in other order of health, another health impairment is a chronic or acute health problem that limits strength, alertness, or vitality of a child. So it states that it is interfering with a child's ability to learn, such as ADHD, epilepsy, and at the same time a child's condition in terms of orthopedic impairment. So let us discuss what is about orthopedic impairment, or what was a severe conditions or symptoms if a child has this. And now let's explore the types of orthopedic impairment and other health impairment. So we have congenital anomaly. Example is clubfoot. So congenital anomaly, it refers to a structural or functional abnormality present at birth. So it can be caused by genetic, environmental, or unknown factors. And number two is disease cause. Example, polio. So these conditions can affect the musculoskeletal systems, leading to strength and flexibility issues. And other causes like cerebral palsy. So cerebral palsy is usually caused by a problem that affects the development of a baby's brain while it's growing in the womb. While other health impairment has a chronic illness like asthma, epilepsy, FAST, or fetal alcohol syndrome, ADHD, and Tourette syndrome. So, asthma, it is a complex and involves a combination of genetics and environmental factors. And epilepsy, it is a convulsion or loss of consciousness. And fetal alcohol syndrome is a condition in a child that results from alcohol exposure during the mother's pregnancy. And ADHD, or attention deficit hyperactivity disorder. And Tourette syndrome, it is a common of it are blinking, throat clearing, sniffing, and facial movements.
So, orthopedic impairment. So, this refers to conditions that affect the bones, muscles, and joints, which can limit a person's ability to move and physical functioning. So, the first one here is congenital anomaly. So, these are the conditions that are present at birth, such as clubfoot and or limb absence. This affects the child's movement early in life and often requires surgery or therapy. So the second one is disease cause. So some impairments develop due to illness like polio or bone tuberculosis. So this disease weaken the bones and muscles, sometimes leaving permanent disability. Next one here is other health impairment. So it affects a student's energy, alertness, and overall health, which impacts learning and school attendance. So the first example here is chronic illness, which are the conditions like epilepsy, asthma, diabetes, or heart disease that require ongoing care. So when we say epilepsy, it is a chronic brain disorder that causes unprovoked recurring seizures. So the second example here is the ADHD and Tourette syndrome. So these are the neurodevelopmental conditions that affect focus, behavior, and self-control. Next one here is other health impairment. So it affects a student's energy, alertness, and overall health, which impacts learning and school attendance. So the first example here is chronic illness, which are the conditions like epilepsy, asthma, diabetes, or heart disease that require ongoing care. So when we say epilepsy, it is a chronic brain disorder that causes unprovoked recurring seizures. So the second example here is the ADHD and Tourette's syndrome. So these are the neurodevelopmental conditions that affect focus, behavior, and self-control.
To prevent orthopedic impairments, we should have proper nutrients, especially food rich in calcium and vitamin D, because these keep our bones strong and healthy and help reduce the risk of bone diseases. We should also use proper safety gear when doing sports or physical activities to avoid fracture and other diseases. For condition that children may be born with early identification and mental intervention, help manage the condition early and improve the person's quality of life. To prevent other health impairments, vaccinations are very important because they protect us from disease like polio that can affect our bones and muscles. Pregnant women should get good prenatal care to reduce chance of birth defects and other health problems in babies. For conditions like asthma or diabetes, must have proper medical management, regular checkups, and healthy lifestyle habits help prevent attacks or lessen their effect on daily life and school performance.
Okay, so hello guys, good evening. Um, today's I am going to discuss the orthopedic impairment intervention. Orthopedic impairment intervention. So, these interventions is all related to school settings because we all know as a teacher, so it is very important, no, to know what we are going to do if we have students that has this kind of condition. So first is adaptive sitting and mobility aids. So of course, as a teacher, no, by this it helps students to maintain comfort, posture, and independence in movement. So second is um, the assistance technology for learning. Of course, like the students that has a condition of impairment orthopedics, so they need assistive technology for learning. So it supports access to curriculum through devices and software. So third is extra time for tasks or transitions. Okay, so it allows students to complete physical tasks without pressure. The other impairment interventions. So first is schedule tasks. Um, it schedule it. As a teacher, you should break it into little. So like step by step, no, so that the students prevents fatigue and support attention throughout the day. Second intervention is the health medical accommodations. So as a teacher, to ensure students' safety and well-being, you need to provide health medical accommodations for your students. And that's all. Thank you.